I'm ready.
Hello, John Doe. I am Alex, your personal doctor's AI assistant. To prepare for your follow-up visit with the doctor, I'm going to ask you a series of questions about your health since your last appointment. Please answer as best you can. The session will be about 5 to 7 minutes, and we would like to cover some general updates, vitals about your diet and nutrition, some lifestyle and general symptoms, and some diabetes complication review questions. Are you ready to start?
Yeah, I'm ready to start.
Wonderful, thank you. Let's begin. First, let me start with the big picture. How have you been feeling overall?
I've not been feeling that great. I was having quite a lot of diarrhea and a lot of stomach pain.
I'm sorry to hear that. Diarrhea and stomach pain can be quite uncomfortable and may affect your hydration and nutrient absorption, which is particularly important to monitor with diabetes. We'll definitely want to explore this further and make sure we address what's causing these symptoms. Now, could you tell me more about any other specific symptoms you've been experiencing besides the diarrhea and stomach pain?
I was feeling very nauseated and also a headache. I don't know if it was related to that. And yeah, I was feeling very weak last few days.
Thank you for sharing that. Nausea, headache, and weakness, along with the stomach issues you mentioned, could be related to dehydration, blood sugar changes, or other factors. These symptoms are important for us to track carefully, especially with your diabetes, as they can sometimes indicate that your blood sugar levels need attention or that there's an underlying issue we need to address. Now, let's talk about your vital signs. What was your most recent weight?
Probably lost some weight. Recent weight that I took round about yesterday was about 120 pounds.
Weight loss, especially when accompanied by the symptoms you've been experiencing, diarrhea, nausea, and weakness, is something we need to monitor closely. This could be related to fluid loss from the diarrhea or other metabolic changes, and we'll want to keep a close eye on this. And what is your height?
Height is still the same, 5 feet 11.
Height and weight together help us calculate your body mass index, which is a useful indicator of overall health. With your current weight at 120 pounds and height of 5 feet 11 inches, you're quite underweight, which combined with your recent symptoms is something we definitely need to address. What was your most recent blood pressure reading?
I haven't taken it for a week. When I last took it was around probably 110 by 130. Is that normal?
Thank you for that. Blood pressure is typically recorded as the top number over the bottom number, so I want to make sure I have this right. Was it 130 over 110 or 110 over 70? Blood pressure monitoring is crucial, especially with diabetes, as it helps us prevent complications and ensure your cardiovascular system is functioning well. Also, given the diarrhea and dehydration you've been experiencing, your blood pressure readings are particularly important right now.
Yeah, it should be 130 by 80 then.
Thank you for clarifying. A blood pressure of 30 over 80 is in the elevated range, but not critically high. We'll want to monitor this, especially since dehydration from diarrhea can sometimes affect blood pressure readings. It's good that you're keeping track of this. What was your most recent pulse rate?
Pulse rate I haven't actually checked.
That's okay. If you get a chance to check it in the next few days, that would be helpful. Your pulse rate gives us insight into your heart function and overall cardiovascular fitness, especially when you're not feeling well. Now, do you remember